I really believe we need universal single-payer health care. I work in a school, I'm a nurse assistant, and there are so many kids in school that can't get health care, so we've got to get it.
You know, so many of my peers, so many people my age, and we have the same politics. We agree on the same things, but they won't come to things like this. And no matter how much I bug them, they're always too busy, they have laundry to do, they have bills to pay. You know, I have to do laundry as well. I just wonder, you know, what is their breaking point? When will they say, you know, laundry can wait and healthcare reform can't? You know, I would feel, if I hadn't come today, then tomorrow I know I'd feel like crap because I had an opportunity to speak up and I didn't take it.
We need a system in which the government just provides healthcare to everyone as a human right, something that you shouldn't have to afford or pay for. A lot of the discussion here centers around this concept of the public option, which is the name that's been given to the healthcare reform that's currently going through the Congress, pushed by the Obama administration, which actually preserves the role of private industry in the healthcare system. And I think the reason why is that the Democrats, since 2008, the Democratic Party has actually begun to receive more contributions from the healthcare industry than the Republicans. Which raises questions about how we're actually going to win a system in which health care is given to all. Namely, I think we can't just wait for the Democrats to deliver it or the Obama administration to deliver it. We actually have to get out here and protest and struggle and march and build the kind of movement that can actually force the government, Democrat or Republican, to provide health care for all. And that's why I think this event is so important, and I hope that this debate and this discussion can actually be raised here, because public option does not necessarily mean single payer, and if we lull ourselves into thinking that it does, then I worry that we might get complacent with what's actually sort of a surface level reform that doesn't really get to the fundamentals of what the kind of change that our healthcare system needs and that people want.
I'm a self-employed, uninsured carpenter, and I feel it's critically important that every person in this country do everything they can to get health care for everybody in America.
I don't know anybody over 50 that does not want Medicare. Affordable insurance, I think that's bogus. It means that let's keep the insurance companies, and I would like to see the insurance companies out. I think we need Medicare for all, like every other civilized country in the world, England, France, Canada, Medicare for all. That's what I'd like to see, Medicare for all.
A clan of dirty Bolsheviks who crawled out of the ghetto and in Krakow, and they all have noses like bananas, and they work undercover to destroy everything which is good and noble in mankind. Pretty soon it looks like a sewer like the Bronx. So if you want your state to look like a sewer like Bronx, South Central LA, Chicago, where the beast man Obama is from, just vote Bolshevik.
It doesn't make any sense to me that we have a healthcare system provided by people whose main purpose is to provide a profit for their stockholders. And I don't see how that's ever going to provide good health care. And I'm just hoping that finally now, after decades too late, we'll actually get a reform that works. I think it needs to be single payer to work, but at least have a public option from day one.
It's great to be here at this rally for health care. The time has never been more urgent. So many Americans are standing on a precipice. Just one illness, one crisis, one job loss away from financial disaster. So we're really hoping that this rally will send a strong message to both Senator Snowe and Collins, as well as our Democratic congressmen, to really work hard, get this done now. Don't take a break in August to give the opponents time to lobby and to kill this thing. But let's do it. We have a great opportunity. There are the votes that should be there in the Senate. Let's make it happen. Let's make it happen now. And we can all go forward knowing that it's a better day for America, that everybody can finally have access to affordable health care, which they clearly deserve.